back to Mitigation Journal, the All Hazards Podcast. This is one of the most listened to emergency services podcasts available on the internet today. My name is Rick Rosati. With me, our co-host,
Matt Comer.
Matt, thanks for being with us. Missed you last week.
Yeah, I got a little bit busy.
Yeah, I had to do the show by myself from the basement bunker and go back to the way we used to do it. But I'm very glad to have you back.
Thanks.
Glad you could make it this time. For those of you playing the home game of Mitigation Journal, we do have the camera running, so you're going to be able to see bits and pieces in video form of behind the scenes kind of thing as to how Matt and I get the podcast put together here every week. This is Mitigation Journal, as I said, edition number 179, being recorded for the week of July the 30th, 2000. Non-pharmaceutical interventions. Now, we're all familiar with getting vaccinated against the disease. Mm-hmm. But as we found out this past flu season, when the vaccine doesn't show up, we've got to rely on other measures to keep the spread of disease, or naturally occurring biologic disease, shall we say, keep it to a minimum. Mm-hmm. Now, how do we do that?
Social distancing.
Social distancing,
hand
perfect.
Washing.
Hand washing, good hand hygiene.
Changing, we talked about this a little bit last time, changing your habits, your greeting habits, rather than shaking hands, for example, tapping somebody on the shoulder or not touching at all.
Yeah.
And that's something that sounds so simple, but it really is one of the most common ways to transfer.
And you'd think it's so simple these days. It just, as adults anyways, they perform good hand hygiene, mm-hmm. respiratory etiquette, coughing, covering your mouth and nose when you cough or sneeze, mm-hmm. and appropriate social distancing. And we're not talking quarantine here. We're just talking staying away when you're sick, staying home from work, staying away from sick people, and as you mentioned, altering the way you greet people would be important. Well, interestingly, a study done in New Zealand, of all places, New Zealand, found that over a period of time, in 2 weeks in last August. Now, understand, in August in New Zealand was a very worrisome time for flu in that area, and pandemic was definitely an international word at that particular time there. So, what they found in this particular study was that about 3 out of every 4 people actually made an attempt to cover their cough or sneeze. The bad part was they covered their cough and sneeze with their hands. Now, we've been advocating that people, cover your mouth and nose, kind of do the Dracula, right, just cough into your elbow kind of thing. So, although they did make an attempt at keeping their germs from flying out into the air.
3 out of 4.
Yeah, 3 out of 4.
I don't know what's wrong with that fourth guy.
he's the East German judge.
Yeah.
You contaminate your hands. That's a great way to contaminate surfaces and items and spread disease. So that was a problem, obviously. So then they go ahead and touch furniture, doorknobs, other items, what have you, and they spread disease that way. Now, interestingly, they found that, as disgusting as this may be, this is in a public place now, in malls and even in hospitals, they found people that continually spit on the floor. They found that habit to continue. Yeah, actually spitting on floors. And they note that it's about 1 out of 30 people actually spit on a floor in a public place. Now, this caught my eye because way back in 2003, we talked about spitting in public places being a problem in the SARS pandemic. Mm-hmm. Yes, I know, SARS was a pandemic. I don't care what anybody says. And that was seen to be as a potential mode of spread there. So, although their findings were fairly surprising, it really has to be understood that was there any impact at all from the public education that went on? Now, pandemic was a big buzzword in the media. Mm-hmm. Public education campaigns went on. Did they have any impact from that? Was the message lost? Was it the delivery of the message? Was it disbelief? Was there a certain level of optimism bias that prevented people from really following these instructions? But it's interesting looking back on some trends. Despite how much we talk about these non-pharmaceutical measures, these interventions, that it just doesn't seem to be catching on. And a 2007 study done by Harris Interactive indicated that about 1 out of 4 people don't even bother to wash their hands when they leave the restroom. So, if we're not doing it in everyday life, we're not developing good habits when there's not a public health crisis, the potential for us to develop these habits in the setting of a public health crisis, I think, are minimal. Mm-hmm. And I think also that it may sound a little trite at this point, but when you look at the bigger picture And in fact, when we have a pandemic or a naturally occurring biologic event or a non-naturally occurring biological event, and we're not able to draw on that memory or have those good habits, and vaccines not available, we're going to put ourselves at greater risk.
Yeah, what's interesting about all this is how do you, from a system standpoint, govern the situation? It's completely out of our control. I mean, other than what we can do for public education, we can, like you said, was the message missed? Was it delivered wrong? We can maybe control the delivery and hopefully get some more creative ways to deliver the message, perhaps, in some more creative or inventive way. But ultimately, it boils down to the general public. And unfortunately, my pessimistic mind kicks in. And unfortunately, unless there really is a pressing personal need, most people don't change, and they won't change. Especially small habits that they probably think are meaningless. By the time you reach adulthood, you're not washing your hands. You don't think about that. It's not something you think about. I'm not going to wash my hands. Ha ha.
Yeah.
You think, you just going through your normal habits. You don't think. You walk out, you wash your hands, never crosses your mind until one day you're sitting in a doctor's office and they're like, you have H1N1, you have pneumonia, or whatever, and, how did I get this? Maybe should have been washing your hands. Or God forbid they bring it home to a loved one who's in a weaker immune state. So that's a scary thing to think about, and I guess that just kind of puts the pressure on anyone who is listening or is reading these things and does have the willpower and want to change their ways. They can be a little bit more cautious and a little more careful with their own self, and they can at least be one more person protecting the public and themselves.
That's another thing is we have a great impact on public education and emergency services. Look at the fire service and how they do fire safety education, stop, drop, and roll, and sure. Those types of programs. And I think EMS providers should be equally as active in helping to spread the message of hand hygiene, respiratory etiquette, and social distancing. And last week we talked about the impact of school closures on home lives during pandemics and how many people didn't stay home and went to other venues. So that whole social distancing piece included there as well. So I'm sure we'll have some more on that to follow as the summer winds down and we start moving towards flu season. Very important to keep that in mind, though, as we go forward. So.